Welcome to the Hypertension Awareness and Prevention Program at Yale. Today we'll be showing you a training video. My name is Tiffany.
And my name is David, and today we'll be showing you how to take blood pressure screenings. First, we're going to introduce you to the sphygmomanometer, or blood pressure cuff, and the stethoscope that you will be using to take blood pressure screenings. So this is the blood pressure cuff, or sphygmomanometer. The cuff is here, including the inflation bladder inside. This is the pressure gauge with the reading on it. And this is the inflation bulb, which you use to inflate the cuff, and the valve, which you twist to control the airflow to and from the inflation bladder inside the cuff. This is a stethoscope with a similar design to the ones that you will be using in your screenings. The stethoscope has two earpieces, which should be twisted at a 15-degree angle. The earpieces of the stethoscope should be pointed away from your face, so that when they insert into your ear canals, you can achieve a tight and snug fit. The end of the stethoscope has two sides. One side is a bell and the other side is a diaphragm. The stethoscope can switch between the two sides by grasping the stem and twisting like this and like this. For our purposes, you want to be using the diaphragm. So make sure that when you look at the hole in the middle of the bell is covered. The stethoscope can only use one side at a time, and so when the bell side is covered, this means that the diaphragm is active. If you twist the diaphragm and the bell side is open, the bell side is active and the diaphragm is inactive. So for our purposes, make sure that the diaphragm is active and the bell side is closed.
For the most accurate readings, you should take the blood pressure of someone who has not drank alcohol or drank coffee or has done strenuous exercise before the reading.
And also make sure that you screen the person's blood pressure before they've eaten their meal. First, you want to orient your patient and prepare them for the blood pressure screening. Instruct your patient to outstretch their arm with their palm up on a flat surface like a table, and have them expose their upper arm. If it's not possible for the upper arm to be exposed without constricting the upper arm or leaving it exposed for the blood pressure cuff, then ask the patient to remove their outer layer of clothing so that the cuff can rest directly on the skin of the upper arm. First, make sure that the cuff is fully deflated before beginning your blood pressure screening. To do this, place the cuff flat on a surface and ensure that all the air has been evacuated from the bladder. Either the left arm or the right arm can be used. Have the patient extend their arm on a flat surface and rest it with the palm up at approximately heart level. Take the cuff and align the bottom edge of the cuff approximately 1 inch above the crease of the elbow. Ensure that the artery markings are facing up and wrap the cuff snugly around the arm, tightly enough that the cuff doesn't slide up or down. You want to align the artery markings, depending whether you're using the left arm or the right arm, with the space inside the crease of the elbow a little bit towards the interior aspect of the upper arm. Since we're using the left arm in this case, we want to align the left arrow just inside the interior aspect, just above the crease of the elbow. Orient the patient and let them know that they will feel tightness and discomfort in their arm temporarily as the cuff inflates. Ensure that the patient doesn't move the arm or talk as you're taking the reading. The inflation gauge has a clip, and there's a corresponding tab on the cuff where you can attach the gauge for easier reading and viewing. Now, you want to take your stethoscope, and again, ensure that the earpieces are angled away from you. As such, take the earpieces and place them in your ear canal to create a tight fit between your ear and the earpieces. First, position the diaphragm of the stethoscope against the skin just above the inner crease of the elbow, so that the surface of the diaphragm rests snugly against the surface of the skin, just below the lower edge of the blood pressure cuff. It's best to hold the diaphragm of your stethoscope with the middle and index fingers so that you don't confuse the radial pulse of your thumb with the pulse of the patient. Grasp the inflation pump in your right or dominant hand and use your thumb and index finger of your right or dominant hand to manipulate the air valve. First, you want to twist the valve all the way to the right or clockwise until you feel it stop. You don't want to over-tighten the valve because you want to be able to carefully control the amount of air escaping from the valve as you decrease the pressure in the cuff. So again, Twist the valve all the way clockwise just until you feel a stop, and then stop. Begin by inflating the cuff to about 160 millimeters of mercury by squeezing the pump to 160. As soon as you reach 160, grasp the valve with your thumb and index finger and slightly twist it counterclockwise to begin allowing air to escape at a controlled rate. As soon as you reach approximately 160, you want to begin to allow air to escape from the blood pressure cuff at a tightly controlled rate. If you allow air to escape too quickly, you will miss the blood pressure reading, but if you allow it to escape too slowly, then you will cause undue discomfort to your patient. The reading at which you first hear the patient's pulse is the systolic blood pressure, and the reading at which you no longer hear their pulse is the diastolic blood pressure. As soon as you no longer hear the patient's pulse, fully deflate the cuff by turning the knob on the valve all the way counterclockwise.
If you get a reading of 120 over 80, a systolic reading of 120 and a diastolic of 80, then that is considered a normal reading for a healthy adult. If you get a reading between 120 to 140 systolic and 80 to 90 diastolic, then it is considered that you are in pre-hypertension. Anything above those ranges, a systolic of 140 or higher, a diastolic of 90 or higher, is considered some form of hypertension. If you have a community member who has a systolic of 160 over a diastolic of 100, it is considered a severe form of hypertension, and you should inform them to contact a physician quickly.
This concludes our training video.
Thank you for watching, and happy volunteering.